Good evening, everyone. My name is Michelle Graham. I'm a cardiologist from Edmonton, and I am the Vice President of the Canadian Cardiovascular Society. And on behalf of CCS, I would like to welcome you all and thank you for joining us for this webinar, Feel Better, Work Better, 1 year later. I would like to start our evening with a virtual land acknowledgement. We extend our respect to all First Nations, Inuit, and Métis people for their valuable past and present contributions to this land we call Canada. We acknowledge the Indigenous peoples of all the lands that we are each on today and reaffirm our commitment and responsibility as individuals to improving relationships between nations and to collaborating in a spirit of reconciliation. Our intent for this evening's session is to have an open and honest conversation about the toll that stress, particularly since the onset of COVID-19, is having on all of us. We wish to equip the members of our community to be able to recognize the signs and provide you and your teams with strategies to increase resilience and reduce feelings of stress. These are our disclosures. Immediately following the presentation, we will have our Q&A session. The Q&A period will be an opportunity for you to ask questions and participate in a constructive discussion. Please use the Q&A panel or the chat option throughout the webinar to send in your questions. If you wish to send your questions in anonymously, please use the Send Anonymously checkbox in the Q&A section. The session is being recorded, so after the session is over, please share with your colleagues who couldn't register. It will be posted on the CCS website. As a reminder, these are tonight's learning objectives. Tonight's event is an accredited group learning activity, Section 1, as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada, and it's approved by the Canadian Cardiovascular Society. You may claim a maximum of 1 hour. At the end of this session, we will be sending you a short evaluation survey that will help the CCS gather additional input to inform future programming. It's now my pleasure to introduce to you Dr. Rakesh Jetley. He is recently retired as the Chief of Psychiatry with the Canadian Armed Forces after a 32-year career. He did his training at the University of Toronto and has deployment experiences in areas such as Rwanda, the Middle East, and Afghanistan. He has conducted research and has published on a variety of topics, including PTSD, occupational mental health, moral injury, and suicide. He holds academic appointments with Dalhousie University and the University of Ottawa. We are incredibly grateful for Dr. Jetley's participation this evening, and I am pleased to pass things over to him.
Michelle, thank you very much. It's an absolute pleasure to be an honorary cardiologist for an evening. It's always special to join my colleagues. I want to just begin by saying, it's really interesting to see our colleagues sort of interested in health and well-being. And as my career advanced, I went from sort of focusing on disease and disease prevention to then understanding that it's not sort of as black and white as you're either healthy or you're sick, but more we're along a continuum. And this is sort of the mental health continuum model that we developed in the Canadian Armed Forces. And I think I put this slide purposely in the beginning just to show that, there's a slippery slope, there's a bi-directional ability. One day we could be feeling well, one day we could be reacting, injured and ill. So what we try to do within the Canadian Forces and certainly within other uniformed professionals is just to help people to understand, whether you're talking about yourself, your families, or others, that mental health is on a continuum, just like physical health. It's not like you're healthy one day and unhealthy the next. So mental health in the front line, I mean, it's a year into this pandemic, year plus, it's a year and a half for certainly people in places like China. And, mental illness, like physical illness, doesn't discriminate. It can affect everybody. It can affect people in different ways. It can manifest in different ways. And as we're looking, a lot of our colleagues, we are doing research. We have to publish on frontline workers, health workers, our patients. We're doing it. It hasn't been published yet. There are some really compelling data from the SARS, certainly in Toronto, but also from Hong Kong, where the mental health impact, not just on the patients, but also on the health practitioners, has an impact. We are, there's a compelling study that came out showing that more than half of COVID-19 healthcare workers are at risk for mental health problems. A very broad what that risk means, but certainly in terms of the wear and tear on the body, on the mind, has really had its impact. And we need to, it's never too late to start looking after each other and ourselves. And I think stress, one of the discussions we had earlier, like a lot of the stuff we're going to talk about today is sort of simple but not easy. I mean, it makes sense, but it's not always easy to create the behavioral changes. So stress, just overall, this concept is the wear and tear on the body caused by the need to adapt to the environment. So of course, it's not necessarily a psychological thing, it's a physical thing as well. And certainly when we exercise, we stress our heart and our cardiovascular system. And I think what's happened here is we've gone from this acute stress that we were feeling in March, and we've gone into this chronic stress. And that's kind of what's been happening with this ongoing pandemic, whether it's at home. I remember huddling with my military psychiatrists last March and had a conference call with from coast to coast. And I remember using the expression that, hey guys, this isn't a snow day that we're facing. This is actually going to be a longer term thing. So we can't just put off a few cases. We're going to have to sort of adapt to it. And I think that's what's been happening with this potential chronic stressors that we're facing. And again, stress itself isn't necessarily a bad thing. Sometimes stress gives you that shot of adrenaline, helps you get through things, can actually optimize your performance. And I think that this is the idea of understanding stress. So, before a big sporting event, you want to be a little bit sweaty, your heart wants to be beating, you want to be ready. Otherwise, the opponent has the edge. But if on the other hand, you're behind the bleachers throwing up over stress, then that's too much. So this optimal stress is kind of what we're aiming for, managing it. And then especially in the extended pandemic, we need to be sort of managing that stress. So I think the sources of stress are important to think about, and I see when I'm speaking to colleagues, I think there's multiple roles that we all play as physicians, where we have to look after ourselves as human beings. We have to look after our peers. We often have students, subordinates, other members of the team that look to us, and of course our families. And as we look at these kinds of things, we could see that there's sort of organizational stressors, which is kind of what's imposed upon us in terms of, we started off with the lack of PPE and scheduling and the different rules and parameters that occur. Operational obviously means actually what's being asked of us and as these waves come and go. And then there's the personal stressors. And I mean, lots of us have had kids homeschooling and trying to sort of juggle between the kids having trouble getting online and looking after clinical matters. And so all of these are different sources of stress. So we all have different stressors of different degrees, but it's also everybody reacts differently to stressful situations. And one of the phrases that, we really got good at saying over the last few years, it's okay to be okay, and it's okay not to be okay when it comes to stress. Just another way of looking at these things. And if one is going to sit back and hopefully there'll be some discussion, some reflection after this meeting, it's important to sort of look at these things, because we're not going to be able to fix things or improve things or better manage things without an understanding. So it is important to look at sort of what aspects, of my organization, my management sort of gets in the way. Maybe I am management. I mean, that's the other point. The operational, what job related factors do I have to learn to live with? Can I do something about? Can I change? And then certainly the personal factors as well, because we are all human beings. We're not living in isolation. Again, just another way of visualizing this. And of course, there's an overlap. I mean, the operational realities interfere with our personal life. The organization can have an impact on our personal life. I mean, we don't all control our schedule. We don't all control supplies. So they all have an impact. And I've had many colleagues early in the pandemic there. They started to live in separate parts of the house, or stayed in the basement to sort of protect their wife and kids based on the operational realities of working in ICUs, etc. And I think, one of the very simple way, again, I talked about simple versus easy, is that, you know, we have demands on us and we have resources. And resources might be my own psychological reserve, my intellectual reserve, and frankly, my physical reserve. And when stress gets to us, the simple way of thinking about it is when what's being asked of me, whether it's my family, whether it's my work, sort of outstrips my resources. I think that's a very simple way of looking at it, but I think it's effective without getting into sort of a complicated way of looking. And for a lot of us, we were in Afghanistan for a number of years, and here's an example where, as strong as the animal is, you can sort of, you can overcome its resources just by demanding too much. So I think, for you as a group, and I've really enjoyed working with Michelle. We published something about a year ago. We spoke about things, and I think, Canada is, sorry, it says several months. I made a change, but it didn't capture. But in this unprecedented response to a global pandemic, we're part of it, and it doesn't matter where you are in the country. Our daily routines have been disrupted, and I think this is the really interesting thing where, quite often in our lives, we've had disruption at work, we've had something happen at work, but you're able to come home and escape from it, or you're able to, have a stressor at home and go to work and escape from your stressor, or go play some sports, or watch your kids play sports. But everything has been disrupted by this pandemic, and depending on where you are, I'm in Ontario, and things have been quite difficult. And I think medicine itself, I mean, the principles such as triage and having to ration care is something that, training in Canada, you don't really expect that. And I remember talking to my colleagues in Alberta about, worrying about oxygen. And I remember training, oxygen used to be just something in the wall. We never thought of tanks and things. And I think unless you've been in war zones or in disasters looking after people after the tsunami, you've never really had to say, that person has a better chance of surviving, so I'm going to do. So principles within our work that we've had to sort of adapt to and apply have really been unprecedented. And so things have, and I'm worried about, the impact that's going to have on some of us as we move forward. So common reactions to this stress and being overwhelmed. I mean, again, there's no right, there's no wrong, but just the kind of things that we should be looking for in ourselves, in our colleagues, in our subordinates, students, is, fear and worry, your own level, your own health, and that of loved ones who may have been exposed to COVID-19. I think, we're at the tail end of it, but every day, if you look at if you pay too much attention to the media, you've always got the other side that's saying, watch out for these Delta variants, here they come, and we're racing to get the vaccines in. The most common way of seeing things, we just notice changes in our patterns, our sleep patterns, our eating patterns, and just sometimes just have trouble focusing. You might forget where you put your key, or things like that, and just sort of paying attention to, have my resources been outstripped by my demands? That's another sign. Worsening of chronic health problems. It's interesting when we see, even if people have, disc disease or other kinds of illnesses, they sort of manifest themselves more, whether it's an inflammatory response that occurs in the body, but that tends to happen when we are not sleeping, eating. There's a guilt component. Sometimes people, we talk a little bit about burnout, and burnout often involves sort of guilt of not fulfilling commitments. I haven't done enough. I could do more. Why am I limited? And that piece. And then there's the other concept. I mean, there could be anger as well. And I've seen that in a lot of our colleagues. I work with the Nurses Health Program here in Ontario as well. And there's anger towards the institution, government, but then you also see, anger towards your fellow citizens that may not be complying with public health policies, or flouting them. And I think that's another sort of common reaction that some people might have. Just a little bit more increased use of alcohol. I think there's many of us that have gone through perhaps drinking more, and there was that baking bread phase, eating more stuff, unhealthy stuff, just because of boredom and just trying things, being stuck at home. Feelings of helplessness, boredom, loneliness, depression, there's isolation. Quite often after stress tends to be a toxic thing, and we almost don't want to infect other people with it. So So rather than reaching out to others, we do the exact opposite and pull back. There's, other health problems can be mistaken for COVID-19 and fear of being infected. And that's been very common, sort of certainly in my circle, where every headache, everything, especially we've had a very bad sort of, pollen season here in Ottawa. So every sneeze and this whole feeling. So I think just whole hyper alertness kind of has everybody on edge, and it's continuing. So I think this is one of the money slides right here, and we've spent a lot of years within the Canadian Armed Forces and our allies. The Dutch military is using it, New Zealand as well, and what we did is we tried to get away from saying to myself, am I depressed? Am I clinically depressed, or do I have PTSD? Do I have this? Because leave that up to the docs. But for ourselves, we should just be thinking about our own behaviors, how we're interacting with people, what we're doing, as just a sign. And so you can see there's a green there. Our Americans wanted to have one bar over. They wanted to have super healthy, because Americans like to have that supersized kind of component to things. But you're healthy when you've got normal mood fluctuations, you take things in stride, your sense of humor is good, performing well, normal sleep patterns. So you're looking at sort of, how am I sleeping, how's my humor, how's my mood, how do I feel physically, my energy levels. And to be honest with you, most of us, aren't there all the time. I think that's the reality. When we have soldiers coming back from deployment, or people coming back from an operation, or perhaps doing a week of call in a CCU, most people are sort of in that yellow zone, and that's what we tell people when they come back from a deployment, or just before they get on the plane to come home. You may be a bit irritable, impatient, nervous. You may have some sarcasm. Your memory might be off a little bit. You may have some trouble sleeping, muscle tension, headaches, and these are sort of normal times when you're reacting to stress. And really, the message that we say to people is that this is normal. Pay attention. If it persists more than a few weeks, or if you start transitioning towards the injured or the ill, then by all means, seek out help, whether it's a peer first, or a boss, or a health service. Just receive help, and you can see as it goes along, the drinking behavior might change. The you might go from being a little bit sarcastic to having angry outbursts. And the way we look at it as well from a self-care perspective is, if you're reacting and you're aware, then hey, work on your sleep, work on some exercise, work on these things. And injured, if you think about it, is more like a fractured leg, and ill might be even sort of more seriously. But you're not going to sort of Google and figure out how to sort of take care of a serious fracture. So the further across the continuum you go, the more you might need professional help. But it all starts with awareness, and the number one barrier to care for people number one barrier to care for mental health is actually people being unaware that they have something going on inside them. It's not stigma; it's actually just a lack of awareness. So the idea of having a self-check and looking at ourselves is really important to see. And if you look over there, most of what we see there are behaviors, not inside. So we can see these things in our peers, we can see these in our kids, in our families, and I think that's the important thing, to sort of pay attention to oneself and the people around you. So I think that the way to reflect on this, and we will make this slide deck available, and I'll talk about the app that we have as well, is that just like I've said earlier, that it's okay to be okay, it's okay not to be okay. But I think it's also really important to understand that not everybody reacts the same way. So we have to realize, so one person may experience stress and they can't sleep and they're up every morning at 4:35 a.m. Somebody else may say when they're stressed, they want to stay in bed all day, they don't get out of bed until 10. Some people may excessively exercise to the point that they're almost going to hurt themselves. Some people stop exercising. So what's really important as we go through a reflection and exercise is to realize what happens to me when I'm stressed, because that's going to be the little seed that I'm watching for later on. What changes in your behavior would others notice? So I've run several sort of psychological trauma clinics, can be quite toxic for the clinician as well. And what happens is you're sitting there listening to people's stories again and again. And what we did is we established sort of a buddy system, whether it's, and it doesn't mean boss or subordinate, it just means a buddy system. So somebody that you trust that can sort of pull you to the side and say, hey, is everything okay? So I think it's important, to establish things like that, to have trusted colleagues, could be your spouse, could be whoever, and just say, hey, you know what, like if you notice me getting, more angry, if you notice me doing this, if you notice me not showing up on time or not shaving or whatever it is, hey, just pull me to the side and we should talk about this. What actions you normally take to regain your health and well-being. And I think it's really important to reflect on this as well and say, you know what, I'm actually the best when I'm able to do this, this, and this, when I'm able to, get out for my runs, or I'm able to, watch my favorite TV show, whatever it is, know things about yourself. And the other thing is that I don't know how many people are on this call, but I think one of the things as well is that the continuum, the previous slide itself, I think that's also a good sort of source of discussion with other people. And I think it's a different way of looking at mental health. And I think it's probably one that resonates better with others. So basic things, again, simple, not easy, motherhood stuff. But the reality is that some of the stuff that we need to do for stress and coping and for health is so sort of simple, motherhoodish, that we tend to ignore it, right? And I think this is hopefully one of the takeaways from here as well, is when we're feeling the stress, when we're feeling tension, when we're feeling hopeless, when it's the middle of yet another shift, you know, if you can, if work allows it, if somebody else is going to sort of, watch the patients for a little while, step away, take a few minutes just to focus on breathing. It's nothing fancy. You don't have to go far, but just really sort of, slow down the breathing, focus on the air going in and out. And that's something that actually, for most people, reduces muscle tension, reduces so that stiffness that we're feeling in our body, and actually clarifies our thought. That's exactly what athletes are doing just before they're shooting free throws, or somebody's about to dive, off a high dive in the Olympics. Pay attention to the self-talk. We all have continuous conversations going on in our heads where people are saying it's not going to work, it's not going to work. And the reality of it is that you can actually challenge and change that thinking. Again, the athlete that's about to jump from the high dive is saying to themselves, hey, you've done this before, you've done this 1,000 times in practice, this is your bread and butter, you're going to do it, versus, hey, you're going to fail. So we can actually change that discussion, we can change that dialogue. Make a list of what you need to accomplish and check off the items one at a time. And I think in this sort of unprecedented sort of pandemic kind of thing, where you can take very little for granted, I think it's extremely important to think about these things, whether it's the kids' homework, whether it's this, all of these different things. I think it's important just to create a list and check them off, because what that does is it gives you a concrete sort of a living sort of testament that I'm actually getting stuff done. Because sometimes we feel hopeless, we feel like we've done nothing, but I think it's important to realize that, hey, I got out and tossed the football with my little guy for half an hour. I did this, because it's very easy to focus on the things I didn't get done when we're not doing this. The next one, of course, is break large project into smaller, more manageable ones, because things can look, overwhelming and daunting. And it's similar to the previous one. And then see yourself successfully handling challenges. I think it's really important, especially as quite often as specialist physicians, we're the leaders, we're the mentors. I think it's important if to pause at the end of a shift or at the end of something and just say, hey, you know what, like, that was a tough one, but we got through it. And I think that modeling, is important. I think it's important for yourself as well, because the gains easily get lost when you're in situations like this. The here's some points, again, some very basic points. The first bullet: avoid excessive exposure to media. I tell my patients that, I tell my colleagues that, I tell my parents that. I mean, it's just because with 24-hour news, same thing we said in 9/11. I mean, it's just too much, too much, too much, and know enough to know what you need to know. But it really is important to put on the Disney Channel and watch a Marvel movie, sort of take a break from that, especially because we're living and breathing it. Again, the taking care of the body. I can't say that enough. I mean, we're learning more and more that the mind-body duality, the brain versus the body, is just such an artificial barrier. There is so much integrated with inflammation, with pain, and the connection. So taking some time to sort of clear the brain, to relax the body, to stretch a little bit, even if it means stepping away from the floor for 5-10 minutes into a call room or something, it actually makes a difference. When you stretch, it actually reduces inflammation in the body, and it increases lots of stuff in the brain as well, the endorphins. Acknowledge and accept the strong emotions. Like it's not helpful to sort of have things rising up inside you and continue to stuff them. Eventually they'll overflow. It's like a glass. It'll overflow, and then it'll come out the wrong. So realize that, hey, this is bothering me, or this is bothering more than it normally would, and sort of take a pause and pay attention to it, and either handle it yourself or discuss it with a colleague or a professional, depending on how difficult it is. Daily structure and routine, extremely difficult in these times, but still the best we can do it, the best we can do it. And with kids with school, and try to keep them in a routine, try to keep the family in a routine. I think that's really important. And then, I mean, if only we all had stock in Zoom and all this, but maintaining the healthy relationships and connections. I think one of the things that is the biggest sort of mental health consequence of the pandemics, and we found it in SARS as well. And when we're looking at the elderly, is just the isolation, loneliness, social connectedness. So it really is important, even though it's not great to have, a birthday party over Zoom for a niece or nephew. It's better than having nothing. And I think maintaining those healthy connections is extremely important. And schedule them. Don't just wait for the other person. Sort of be proactive about these things. And these three or four are just examples. And what'll happen is if we pay attention to this aspect of our lives, we'll find the things that'll work better for us and for others. Extremely important. I think, again, I'm emphasizing this one more. Draw on skills that you have used in the past. I mean, it doesn't help for me to say, hey, it helps when I go for a run, or it helps me when I do this. Think about when things have been good for you, and what aspects of things you've done best, whether it's, fresh air, whether it's getting on an exercise bike, whatever it is for you. Um, Hope and positive thinking. It's, again, sounds motherhood, but positive psychology, thinking positively, setting that example for yourself and others. It's funny, when you look at the positive psychology, I remember a colleague of mine that studied in this field said, positive psychology doesn't guarantee an outcome, doesn't guarantee the right outcome, but at least it gives it a chance, right? And I think that's the kind of idea that we're talking about here. And focus on the positive aspects of life and things you can control. It's very, very easy. We have lists always of things I can do, things I can't do, and we tend to focus on the can't. I mean, I've got 3 teenagers at home, and this last year has been all about things they can't do, and I have to kind of remind them again of the things they can do. And I think that's going to be part of the challenge, is sort of making that shift. And again, I can't reemphasize the exercise. Again, we do know that it's important, and it's been modified. The gyms have been closed, and lots of things, but still, the best we can do to maintain that. It has obvious health effects, cardiovascular effects, and all this, but it also has huge, huge benefits. If you Google sort of running and depression, you'll find more hits than antidepressants and depression. So it's extremely important. So bringing in recovery time, and I think this is a really interesting point. A friend of mine whose kids were sort of Olympic level athletes, once asked the coach, can you train too much? Can you train too much? And the coach basically said, no, but you can recover too little. So the whole idea, we know that from exercise now, compared to perhaps when some of us were young, that you don't need to run every day 10K. You don't need to run multiple marathons to train for a marathon. And the reason that is because the wear and tear and not giving the body a chance to recover. So I think the concept of building it, so we can all push, we can all exert ourselves, we can all do this. But the key ends up being is giving ourselves time to recover. Now, again, maybe easier said than done. There's schedules that we have to fill. There's work. There's covering night call. There's people get sick. There's not enough nurses. And there's a whole bunch of things like that. But I think in principle, just the whole idea of paying attention to after I exert myself, I can push, I can go well, is what do I need to do to recover? Do I need to sleep? Do I need to eat? Do I need to go for a walk? Because going back into the fire without recovering sufficiently is when you increase the risk of injury. And it's absolutely true physically. The NBA knows that the second night of a back-to-back, when they play 2 nights in a row, the chance of getting injured increases by about 40-50%. But it's the same thing psychologically. If we don't give our mind a chance to sort of stop, reflect, and go back into it, then we increase the risk of injury. And we'll talk a little bit about burnout, but it's again the idea of sort of being sort of starting to become sarcastic and sort of emotionally labile and things like that. Again, this is from our friends at Bell. The idea of so this holistic idea of recovery, physical, social, mental, spiritual. And I really think, again, the idea is just like there's no right and wrong. It's okay to be okay. It's not okay to be okay. It's extremely difficult to sort of, in a prescription, say, you go do some weight training, you go get some sleep, you go talk to your kids. I mean, so the real idea is to find out what works for you and what doesn't work for you. Some people like to go for a walk with themselves. Some people like to go for a walk with family. Some people like to do it. The key is have something that is your go-to thing that's going to help with your recovery. Because as we go through the cycle, the longer and longer it goes, we have to sort of develop this cycle of stress, recovery, stress. So when's it time to seek help? We touched on this a little bit, and I think for those of us that have jobs that are high stress jobs, whether it's almost being any kind of physician with the responsibilities that we have, but certainly superimpose a pandemic onto that and superimpose sort of the impact on family. Being in that sort of yellowish zone kind of makes sense if it starts to become uncomfortable. But once we start sort of getting into that sort of ill and injured kind of category, so if the negative feelings sort of persist, it's not for a day or two, or it's not, hey, I woke up the next morning, I was bummed for half an hour, but decreased enjoyment, if we're finding even things that were our go-to things aren't helping. Change in work performance, if we start to become more sarcastic, impatient, testy with others. Sleep is key. I mean, we find sleep, whether it's PTSD, depression, anxiety, all of these things. So there's something about sleep that really, I mean, I know people are working shifts and they're working nights, but again, it's if you've been doing it for a few years, if you find it worse than normal. Physical symptoms are often a key as well. Headaches, gastrointestinal difficulties, often back and shoulder pains are also part of things. And also if you start to see that, your relationships are getting strained, and not just the little bickering back and forth, but if there's sustained difficulty in relationship, these all may be reasons to take a pause, reflect, and perhaps even reach out for some help. So I just want to sort of finish up with, within the military, our program that we had, which was sort of our resiliency, stress, and wellness, was called the Road to Mental Readiness. And we developed that in a way, initially thinking about giving people the tools for their deployment. And deployment is an operational sense. But then we sort of did another one sort of to come home. Then we did one for people, for their families. And now there's over 31 separate programs. Some are specifically for health professionals. Some are for military police, unique. So we've got a lot of them. But for this purpose of today is that we did create an app. It's a Road to Mental Readiness app. We've worked with NATO. The Dutch have adopted it. New Zealand is now using it as well, one of our Five Eyes partners. And this app has, I mean, it's really it's a companion to a course, a 2-day course, but it does have in it sort of a way of doing a self-assessment like we talked about along the continuum. Where am I today? Where am I tomorrow? It does have in it sort of some of the tools such as the, we call it tactical breathing because in the military, everything sounds tactical. It's kind of cool, makes you think of snipers, but really it's good old box breathing, yoga breathing, positive visualization, self-talk, plan smart goals, all of those basic skill sets. So please, there's no cost, download it, share it with your colleagues, share it with your families. And I think, even without the course, I think there's still some benefits. And of course, having things on our phone makes it much easier than having to put things on a fridge magnet nowadays. So I think we'll stop there. I wanted to keep it brief because I really wanted, hopefully, that we could trigger a discussion today. And thank you for there's lots more material that we can make available depending on questions, but I really wanted to see if there's some questions now.
Thank you so much, Rakesh. That was absolutely fantastic. We're going to have lots of things to talk about. So now, folks, is the time to ask your questions. Ask them in the chat box, ask them in the Q&A, and a reminder that if you want to send your questions in anonymously, just select the little send anonymously checkbox. So we're going to start with some of the questions that are actually in the Q&A, and then I have a few of my own. So the first question is, if we are finding that our stress is impacting our work, how can we broach the subject of stress and mental health to our employers and bosses without feeling judged?
Well, I mean, that's an absolutely fantastic question. And I think, as physicians, I think we are leaders. And I think that, and again, you got to realize the environment that came from is the military, right? And early on in the military, I remember I'd be giving talks on mental health, and the commanding officer that invited me in would make fun and say, hey, it's time for the doc to give us a touchy-feely session. Within a couple of years, people like that would stand up and apologize afterwards for how serious it was. And around 2010, 2011, the base chief in Petawawa, the senior non-commissioned person, said, hey, I used to think people with mental illness were weak, but now I realize they're the ones with courage, right? So I think there's stigma. I think there's barriers to care, but somebody has to kind of lead. And I think if there's discussion amongst peers, I think it's absolutely crucial that some people set the example. You guys may be familiar with Vice Admiral Norman, who left the military a few years ago. He was a 3-star, so second Vice Chief of Defense Staff. He sought mental health care several times during his career and was quite public about it. So I empathize with the person asking the question, but somebody has to go first. Somebody has to raise their hands. It's the elephant in the room until then, right? And I often talk about how, we've all sat there, I have as well, where you watch a colleague sort of going down that spiral where, they show up to work a little bit later, they're unshaven or this, and then all of a sudden they're off on stress leave. And it's like, but when you think about it, it's not all of a sudden we watch that spiral. So I truly believe, leaders need to set the example, because if leaders don't, then people are going to struggle. Others are going to have a harder time. So I think it's a discussion amongst yourselves, whoever the leaders are, and then really set that tone. And I think, again, this is not a sprint, it's a marathon. So if somebody needs to take a knee for a little while and recover, I mean, as a team, we ought to be able to look after that person.
That's terrific. And look after that person without making them feel worse.
100%.
Right?
Congratulate them for it. Yeah.
Absolutely. Absolutely. And this is a good message for the leaders amongst us that, we have to normalize talking about this. And apropos of your saying taking a knee, the next question is, what are some good ways to feel comfortable taking time off or taking breaks when there is anxiety about work piling up in your absence?
That's an excellent question. I mean, it's so it again, it's the model, it's the culture, it's what we have to change. Now, I'm old enough, like I'm not going to start with back in the day, but I trained in the day where neurosurgery call used to be you start on Friday morning and finish on Monday night, right? And I remember in my internship, I think it was, I was doing neurosurge call on a Saturday night. I met the fellow. It was like 2 in the morning, and I think I was eating a chocolate bar, and I told him, "Hey, this is all I've eaten today, right?" And he said, "I don't give a shit. Like, why should I feel bad for you? That's your choice, right?" And then after that, I always became the guy. And I remember when I was a senior resident, I was chief resident eventually, that I would make sure people take that pause to eat. I would say, yep, there's patients waiting to be seen, but we'd start that weekend call. I'd say, okay, what are we going to have tonight? Let's have some jerk chicken. Let's do something. So I think the key ends up being is that when we're looking at a pace, when we're looking at it's not a sprint, we're not running a code, but the work is always going to be there. It's a self-care piece. When a military goes into places, one of the first thing that gets set up is the kitchen, right? We send 7,000 troops across to fight a war, but you make sure kitchens, showers, bathrooms, of course, you make sure the perimeter is safe, but you really make sure that that looking after people, because your people are the resource that is invaluable. So I think, as leaders, we make that calculated risk that if we don't pause now, if we don't do this, the work is always going to be there, but we risk sort of, again, to take the metaphor further, I mean, you risk casualties, right? You risk people falling away if you don't take that pause. So it really is a matter of like we talked about, the cycle of stress and recovery. And what recovery means, it has to be, you have to allow people to step away and do that. And let's, I mean, as serious as it is, it's not as if, and again, if you're running a code, completely different. You can't say time out now, but to go away for a little while and FaceTime your kids when you're doing it overnight. I mean, that's absolutely not only appropriate, it should be encouraged.
Yeah, I have a rule in my CICU when I'm attending, which is always have lunch.
Yeah. Yeah.
So, I mean, we may not all be able to have lunch together, and certainly with the pandemic, we're not allowed all in the same room.
Yeah.
But the rule is always have lunch.
Yeah. Yeah.
And then the other rule at the end of the day is trust your backup.
Yeah.
So that you can go home.
And
so
when you're having lunch, though, Michelle, you're modeling that for other people. You're then letting the residents and the trainees and the students know they can have lunch as well, right? I mean, I think that's the key. If you don't, then you're saying on this service, you don't have lunch.
Yeah, I make it a rule. I tell them every day, we're having lunch today.
Yeah, exactly.
So, yeah. So while I'm waiting for other questions to pop up in the Q&A, hint, hint, everybody, I have a few others. So I've obviously been doing a lot of reading about this. And one of the things that I've seen is that there's an impetus to change the terminology from something like burnout to something like moral injury. And, I've done some reading about it. It appeals to me, but I thought maybe you should explain it to the group. Tell us about moral injury.
No, it's a fascinating area of interest, and I've done a bit of writing and some some NATO groups on this topic. So they're kind of, I mean, interestingly, both burnout and moral injury aren't sort of official diagnoses, right? But again, you can have suffering without reaching a diagnostic criteria, right? I think that's important to realize. So burnout, has this connotation of I'm not good enough, I've fizzled out, I've crashed and burned, and I mean, that's not entirely fair, but that is sort of the way it's been like, oh, she's burned out, or this kind of idea. But burnout often involves sort of dismay, hopelessness, sarcasm, this kind of thing. And moral injury is we really started discussing it again in the 80s with a guy named Jonathan Shea that was treating a lot of Vietnam vets. And the moral injury is the kind of thing where you've either participated in or witnessed or been silent party to things that go against your morality, right? I mean, there's ethics and there's morality. Morality are your inner views, not part of what the rules are of medicine, for example. And so you often feel guilt and shame if there's things that I could have done, should have done, didn't do, didn't stop other people from doing, right? And that could be just simply, what your experiences have been like. And I've spoken to a lot of nurses in long-term care facilities in Toronto and things, and so you can feel that. And then the other importance, and so from soldiers, of course, it's seeing people commit war crimes and not doing something or being part of it. But then the other one that people often forget is the anger. And the anger often comes from this concept of institutional betrayal, right? And when you sit and you talk to people and say, how did we get ourselves into this? We saw this. And the institution could be the government, it could be your own facility, it could be your own leadership. And I think it's important to know, why am I feeling angry? And I mean, a lot of us talked about, in Toronto, we learned our lesson from SARS. We had the books written, we had the papers, we had the stockpiles, but then we let it go. Why did we let it go? And I think it's not just so that we have something to bitch at, but it's more to identify what we're feeling, right? So if we're feeling guilt and shame, it's this difficulty with what we have done or didn't do. And if we feel anger, it could be because of this institutional betrayal. And the so what of it, of course, is that there are ways of sort of dealing with it. If you get stuck, you might need to sort of, speak to somebody, a therapist or something. But otherwise, peers can help with this, and people can help put these things into context. And there's a concept called acceptance and commitment, right? And the idea is sometimes, we need to grieve something, accept it, and then move on. We can't move on if we're still stuck there, right? So I think it's important. I think the labels are sometimes important, and when we're feeling yucky, to kind of say, what am I feeling? Am I feeling, guilt? And the guilt may be appropriate or inappropriate depending on what you did, but it's just often gets in the way of functioning, right? So whether it's appropriate, inappropriate, we have to deal with it. And anger is different, and so the solution to them are going to be different as well. So I think moral injury is a great concept. I think we're doing some study with neuroimaging, and we're going to eventually demystify it and figure out exactly where it lies in the body and the brain. But I think it is a really important concept, and I think it conveys. I think the concept, the paradigm of an injury to my soul, to my psyche, is much more appropriate in these contexts than you've burned out. You just haven't been able to keep up.
Okay, that's terrific. So we have another question, which is also an excellent question. We are peppering you with excellent questions tonight. How can leadership encourage an open conversation with employees? Are there any key terms or themes of discussion that could foster a level of comfort within a team? That's an amazing question.
It is, and I it's the craziest thing. I mean, the military, it's all hierarchical, right? And so the most effective thing that we had is it, and I just it's funny about stigma, right? We do all the study about stigma. Bell spends us millions of dollars and all of this, but the most powerful thing to overcome stigma is meeting somebody with mental illness and having them shatter your myth about it, right? So 1 in 5 people has mental illness. Many people have sought care. And so in the military, the most powerful thing would be when I remember for Bell Let's Talk a couple of years ago, I went to Winnipeg, and the base commander was introducing me. He's sort of the god on that base. I mean, everybody has his own car with a little flag on it, people saluted and all this stuff. And before introducing, he talked about his own burnout and seeing a therapist. And so what happens is, then you might have an idea in your own mind of what a mentally ill person looks like, but then all of a sudden your leader has it. So suddenly you've got this juxtaposition, this cognitive dissonance between them. I was giving a talk in Halifax once, and a young woman said to me, "Sir, is it true that if you have depression twice, you get kicked out?" And I said, "Look, if there's a memo, I haven't seen it, then I probably would have written that memo. So not as far as I know." But then again, the leader, the base commander, stood and said, I was depressed and drinking after I came back from Afghanistan, and I had trouble. I went to care. My battle buddies looked after me, and that was my second time depressed. And you know what they did after that is they promoted me and put me in charge of a warship, right? So I think, uh, like the best way to encourage dialogue is for people to feel safe and comfortable to disclose. You can never make people disclose their personal health information, but think about how little trouble people have speaking about their degenerative disc disease or their,
Mhm.
this. So somehow, I mean, it's funny because I did most of my training in Toronto, and my patients will certainly sit over a cappuccino and talk to their friends about their shrink. I mean, I think once it gets to that point of we can treat this like any other illness, and not be embarrassed to say, I mean, if you went away because you had a heart attack and now you're back, you'll tell people. If you went away because you had a quote unquote nervous
Mhm.
breakdown or depressive episode. So I think leaders have to model. I think leaders have to, own it, have to sort of set the tone, and then that suddenly makes it okay. And
So if you had a leader, a base commander who was, um, had not personally experienced the illness, but was still wanting to be supportive of it and normalize it and make it sort of, this is a safe space to talk about it, how would you sort of present
well,
that to your group?
I think it starts with things like this. I think it starts with educational sessions. What tends to happen is, Michelle, from a you know bottom up, top down kind of way. I've probably done stuff like this, hundreds of times over the last 20 years. I'm speaking in Niagara Falls to the chief of firefighters of Canada or Ontario. I can't remember, a bunch of crusty old firefighters. And you give a talk, and then somebody comes up and starts asking questions, and invariably somebody starts and then turns around, talks to the crowd, and then talks about their own illness. So I really think that I think it starts with sort of educational sessions in this kind of a format with live discussion. And I truly believe the lived experience people are the catalyst. I mean, you can sit there as a shrink
Mhm.
and talk about all kinds of things, but it's really the lived experience people that will be helpful. And I think it starts with residency. I think residency is a eat your young kind of facility still. We know that. And I just think that it shouldn't just be lip service and pamphlets and 1-800 numbers. I think there should still be a human touch, and having given people a chance in a safe environment to discuss it. But I really think that the field needs, every group needs, people with lived experience to share. You can't
And
make them, but that's the catalyst in my
right.
experience.
Right. And what about that special case? What about the trainees? Because the trainees have this added layer, right? Like in the hierarchy, they are the bottom of the totem pole, and they probably perceive that they have the most to lose because they're
Yeah,
looking for they're looking for fellowships, they're looking for jobs,
yeah.
that sort of stuff. How do you help a trainee?
Well, I think, if we look at our, I mean, we've got our sort of objectives for this, and in brackets we put what our Royal College sort of values, whatever they're called, those 12 things that we have to do. But at the end of the day, our responsibility to the trainees is we're their models, right? And I think there's always a double-edged thing in the sense that they feel like this, but they feel like this because we make them feel like this, so we continue to
Mhm.
make them feel like this, right? So I just think at the end of the day, and I know all fields are different. I remember, taking when I was chief resident, taking my group of psychiatrists out at like 5:30 on a Friday. We'd go for a beer or something, and the orthopedic surgery group came in. Oh, psychiatry must be nice. You're leaving. And I'd say, yeah, have you guys had breakfast yet? Right. So,
Yeah.
so I think we can model it. I think the beauty of trainees, whether it's your kids, whether it's high school, whether it's university, is that that's also when they're malleable, right? So if we look, I think leadership, authentic leadership means genuine caring about people. I think in this day and age of privacy and all of this, you know, you should know who's married and who's not married, who has kids, who has young kids. So like show some genuine interest in people, find out what's happening in their lives, find out when, because you're not going to notice a shift in people until you know their baseline, right? So I think authentic leadership modeling, I think if you as an attending, as staff, you know, like you're getting together with rounds, you know, how are you guys today? How are things going? You know, the talk about, you know, the I mean, we talk about the Leafs a lot in Ontario, but talk about sports, talk about something. Show your
Yeah.
humanity, show to them that there are things that are like medicine's extremely important, but there's other things that are important in life as well. And I think if we kind of give them permission to be a little bit more broad, because I think if they're narrow and worried about every step they take, is because we've perpetuated that.
Yeah. Yeah, I completely agree. Well, we're going to have to wrap this up. So I want to thank everybody for joining us tonight. I hope you've all gotten something out of this. I know I have. We've included a reminder of just some of the resources that are available across the country. And depending, of course, on where you live. And of course, we've included the resources available through the Canadian Medical Association. Please take a minute to complete the evaluation that's going to come to you shortly, and you'll receive an email tomorrow with direction to download your certificate of attendance. This program's been recorded, and all of this information will be posted to the website in addition to the additional information that we are going to provide. And this is a little ad for some of the upcoming CCS programs in the next few weeks. So if you have the bandwidth and are interested, we'd love to see you there. And I just want to say thank you to Rakesh. This was fantastic. Thank you to everybody for coming.
Pleasure.
Good night, everyone, and be well. Thank you.
All the best. Thank you, Rose.